Wow, what an amazing conversation. Thank you, Sarah. Thank you, Amy. Thank you, Elizabeth, for sharing all that. Wonderful that you could connect with all of us virtually and share your stories. Really got a kick out of the fact that Amy and Sarah, you'll be connecting after this virtual symposium, and we've made that connection. So please, likewise, everyone, use the platform, chat it up, Q&A, share stories, ping each other. That's the reason why we do all this. Second is, Sarah, you mentioned 107 great catch stories. I wanted to make sure that you understood that's what we do. It's everything we do, right? It's why we do what we do. We share on a monthly basis with our entire company these great catch stories so that we're really focused on the importance of the work that we're doing, that you're all doing. And so Sarah will ping you in terms of those 107. We'd like to share all those. Hopefully you jotted them down. I'm kidding. I also wanted to mention that form factors came up. Camera in every room is something we're hearing about every day. Sure, you think of AvaSure in terms of our mobile devices. They're tall, but we also have ceiling devices. I want to make sure to mention that we also have this Guardian Access device, the technology as it goes. And this is something that can be wall mounted and connected through HDMI to a TV. That way there can be a visual display. And so that is also something where we're improving our form factors. If you want to learn more, we have hosted monthly webinars, and each of them is online. We want to communicate more and more with you, our users and our customers, so please look for those things on our website. It is now my pleasure to turn it over to Mary Boyd for our next session. We mentioned the AvaSure Spotlight, so we're going to focus now on our clinical strategy team, and so over to you, Mary.
Thanks, Dave. Greetings to our AvaSure Symposium audience. It's my pleasure today to speak to you with some of our clinical experts who will soon introduce themselves. As Dave mentioned, I'm Mary Boyd. I'm the Vice President of Customer Experience at AvaSure. That includes the teams that help implement your programs and support them through clinical success, engagement, and customer relations after the go-live. So let's get started. This is Julianne. She's an RN and MBA and one of our clinical strategy advisors. Please tell us a little bit about yourself.
Yeah, well, welcome to everybody that's watching us out there. And my role at AvaSure is a clinical strategy advisor. It's been about 2 years that I've been with the team and just loving it, working with the success program team. And I've been a nurse for over 30 years, the majority of it in nursing leadership. And part of my role is getting to work with the key executive stakeholders with their projects and helping with data analysis and metrics.
Thanks, Julianne. And then our next guest is Dana Peco. She is the Director of Clinical Sales. She's an RN and MSN.
Hi everyone, my name's Dana Peco. Like Mary said, I'm new to the AvaSure team. I've only been here a few months and my role is a little bit unique. My role is focusing on before you even start to implement the solution. I join the sales team to come on site, evaluate your workflows, understand your technology, help strategize to see what of those challenges or pain points you're trying to solve. Much like Amy said in the last session, it's really important to make sure that we have all the key stakeholders involved in these decision-making processes. And so the key to our success is to walking your floors, talking to your caregivers, understanding not only their macro problems, but the micro problems the organization is trying to solve for, and making sure that AvaSure is a right fit for you, and making sure that our implementation will be successful. And I work closely with Julianne because she'll work with you after you sign with AvaSure and start to implement your program.
Thanks, Dana. It's a great overview of your role. Can you tell us how this really assists the customer?
Sure. So as I said, the goal of the clinical assessment, we come on site, we work with your stakeholders. It only takes about a half a day to a day. I've been doing this for many years. As Julianne said, I've been a nurse for 25 years, and I've done this role with other organizations, and it really proved effective because, like I said, a lot of times we're making decisions and we don't really truly know the core challenges that you are facing and what your caregivers are feeling. And the goal of the assessment is to come on site, evaluate what you're doing, like I said, from a workflow, but we're also going hand in hand with a clinical sales engineer who's looking at your infrastructure, your technology. Like Amy and the others said earlier, you really need to look at how that works together to make sure that's a seamless integration and a seamless process. So it's 100% free, so come on, I'd like to travel across the country and meet all of you that are virtual, but the number one goal is to really work with you and make sure that your decision makers are not just the leadership team, but also your caregivers, the people who are going to be using the solution in the future.
Great. So once you complete these assessments, what kind of feedback do you give to the team, and,
Sure.
and who do you interact with at the site?
Right. So the day is pretty simple. What we do is we come on site, we meet with your, we always want an escort because we want somebody that can bring us around from the unit to really kind of navigate all of the organization. We gather all of our findings, and then at the end of the day, we'll have a debrief. We'll talk about high-level findings, meet with your clinical leadership. So oftentimes we really want to engage with the CNO, the CIO, CFO, and then your director of IT, because this is a combination of a clinical implementation, but then also IT. So we really make sure that all of the stakeholders are at the talk in the table. So we discuss it at the end, but then we also will give you a deliverable. It's a document, almost an executive summary of not only your clinical workflows, but also your technical information so that you can see how we can seamlessly move into your organization. So the day takes about, we spend about 20 to 25 minutes per unit. We're pretty nimble. We get in and out because we don't want to intrude too much on your care teams, but we do want to speak with them. And then we're usually a half a day, have about a 1 hour meeting at the end of the day, and then we will regroup a couple days later and really do a more high level understanding and discussion.
Do you ever have any surprises?
All the time. So like I said, I'm new, so I'm just really kind of sinking my teeth into it. But some of the things that we're finding, many people had to do what they had to do for COVID, so we're finding a lot of baby monitors around the organizations. Although these worked effectively when you were, stuck with COVID, you didn't have a lot of options. We are identifying a lot of that. We really want to bring to light that some of these technologies are not safe, they're not secure, they disappear, they break, they fall. So we really want to think about those use cases that you're using baby monitors for, to go ahead and use AvaSure. And just talking about some of those unique workflows, I went to one site recently, and we're always thinking about telesitter and obviously virtual nursing, but one of their biggest challenges was throughput, getting patients in and out and moving them through. And one of their barriers were their wound and ostomy nurses. Their wound and ostomy nurses were limited resources. They had to work clinic time first, so they may have a consult on the chart to come in and educate the patient before discharge. Well, they have to complete what they're doing in the clinic first. So they may not get to that patient till 4 or 5 o'clock, which causes obviously roadblocks and throughput challenges. So just talking about how we can, as the last session talked about, using that virtual nurse component to expedite some of those throughput challenges. And those are just some of the early use cases I'm finding. I'm sure we're going to find a lot more, but it helps you kind of start to think about challenges you're having in your organizations outside the macro challenges with staffing and telesitting, but just thinking about all these other use cases you can use AvaSure for.
Great, thank you. That was a wonderful overview. Julianne, let's shift a little bit to the clinical strategy advisor role and tell us about how you work with customers.
Well, I usually start with about an hour's worth of time just to get to know you and to level set the foundational strategies. We have 5 key strategies, and to review those with you, but also to target in on the 5th strategy, which really is your quality program around your telesitter program. Telesitter is an intervention, and it is key in preventing safety events as well as reducing costs. But we need to make sure that we know what our expected outcomes are for it. And I was told once when I was a young nurse, you get what you inspect. So by setting up a clinical program to measure the key performance indicators, which are your falls, any other events that are key in your organization, as well as cost metrics, and marry that up with your ORNA data to see how that program is impacting it is really what is important for your quality program. So data integration is really what I work mostly with. There's about following up with a first meeting, then I work with you. We provide you tools and resources so that if you've not done something like this before, we really equipped you with everything you need. We have our key recommended indicators and go through them with you, walk through you with a working document to help keep track of the information that we're looking for. But we're also working with you to have that as a shared piece of information. So we keep it on hand. As programs change, go through time, sometimes our leaders and organizations change also. And so that gives us that key source of information to be able to help your new leaders as they're coming on board. Gives them a great eyes view of the progress that's been made over time. Integrating ORNA with your key metrics is just really a very important piece.
Can you give a brief overview about what ORNA is for those that might not be
Sure. ORNA is the online reporting of data analytics, and so every keystroke that your telesitter or monitor staff member makes, it becomes a piece of data that gets added into the raw data field log, and that log then is available in a CSV and what I've come to learn, a JSON file. So there's a lot of things as a nurse that you learn as you're going through this process. But that then is uploaded into our ORNA database, and we right now have over 700 hospitals, over 1 million patients that have been monitored, and over 81 million monitoring hours. So we have big data and rich data. And you can really, we have 34 reports that you can generate out of that, comparative to different groups, all ORNA users, acute hospital, teaching, rehab, pediatrics, and VA even. There's even more. So,
Great. So who do you usually work with in developing the KPIs, and at what part in the customer journey are you interacting with the system?
with all new organizations, I meet with the key executive stakeholders, their nursing leaders, quality leaders, and maybe program leaders also. We're looking to ensure that the KPIs that are selected for your program dashboard are consistently supported across the organization, from that executive leadership all the way to the front line. So starting with that group, and then in our follow-up meetings, working through the dashboard, usually it's the quality leader and the program leads that help work with me to get those definitions and metric baseline data and targets established.
Great, thanks, Julianne. Dana, another question for you. So if there's one trait or characteristic that creates a successful clinical assessment, what would that be, and how does it help the hospital?
I think partnering with us from the very beginning, talking through what the goals are of the assessment, making sure that all of the folks that we're going to be interacting with are aware that we're coming on site. Sometimes that's a barrier. Really communicating. Communication is the key to making sure that this assessment is successful. As I said earlier, we'd like to get on site early and meet with the stakeholders. A really good use case to go ahead and go to your bed huddles if you have bed huddles in the morning. That really kind of sets the stage, let everybody know that we're on site. But just really kind of, I always tell people you have to have earmuffs on. The reason being is as we're walking through, we want to be transparent. We want staff members to be open and honest about what their process is and what their workflows are. We don't want this to be a punitive engagement. We really want people to feel comfortable in talking about what they're seeing within their organization or maybe even just on their unit. So it's just really to be open-minded, receptive to the process, and just make this an open dialogue so that we aren't being punitive. We're really getting great information from your staff.
Similar question for you, Julianne. What is the best way that you see hospitals benefit from your guidance in driving the quality and outcomes that they're seeking?
Yeah, well, our top performing hospitals are really engaged with developing their own program dashboard, working with us to have that established, and then using it for monthly, quarterly reporting, getting the information through which I always recommend leveraging their shared governance structure, so that even the frontline team can see from that drilled down perspective, how are they impacting patient safety and quality? How are they helping each other to create safe workforce environments? And so that's what I see the most effective. It's really using their data.
Is there anything I didn't ask you about that you're burning to share with our audience?
Well, I hope that even though I work with all new customers, that even existing customers that have their programs for a period of time but are maybe looking to take it to the next level will reach out to us and meet with myself or Jennifer Ains, our other clinical strategy advisor. Just really looking forward to those type of opportunities.
Great. That's Julianne Carey. Give her a call. Dana?
I think the final word I would say is really engaging us to do these clinical assessments before you make the decision to move forward with AvaSure is really powerful. We give you a lot of information about what's really happening in your organization and setting you up for strategies of success, and leveraging that shared governance as well to really make sure that those clinical stakeholders are engaged in the process. They feel like they're part of the decision. They have a voice at the table to really kind of help this process move along in the buy-in in the long run.
Well, thank you both. We're running out of time, so I appreciate you sharing your knowledge, and I'm sure that our audience benefited from this session. Thank you.